అది మేలు వస్తుంది.
Yeah, Surendra sir.
Yeah, good evening all of you. Dr. Javirao sir, Sanjay sir and Srinivasan sir. This program has been started almost 1 year ago during the COVID time. And we are happy to take this program forward so that we can hear from the legends their pediatric practice experiences, which will be useful for the youngsters. And I request Dr. Ashwant Javirao and Dr. Sanjay sir to start the program from today. Thank you.
Sanjay.
Thank you, sir.
Sanjay.
Yeah, JV, please.
I think you can start, sir. Welcome, sir. Dr. Srinivasan, sir.
Thank you very much,
we
sir.
will go ahead with the program.
Definitely,
and it's
thank
our
you.
privilege to have you.
Before 1 minute, sir, JV sir.
Yeah, please.
The Tamil Nadu State Secretary, Dr. Saren, is there. He is also a student of Dr. Srinivasan. I would like Saren to speak. Dr. Saren.
Okay.
He's a neonatologist, DM neonatologist.
So I'm not a neonatologist. I'm not DM neonatologist, but I'm a neonatologist, but not DM.
Yeah,
thank you
Saren.
very much, sir. But it's wonderful listening to my teacher. See, I have been lucky enough to be as the intern, then as a first year PG, second year PG, and final year PG. And there are so many clinical nuggets which I have learned from him. And I owe my entire clinical skills, what I have learned, what a little bit I have, to sir. There are so many instances where he has picked such a simple clue to get great diagnosis. In fact, sir was talking to me about 3 days back about some of the cases, and I'm very sure all of us are eager to listen to sir's talk. Even as a final year, I still remember. I have no shame. Between the two of my colleagues who are very good students, actually, we are fighting about a child who has got a murmur, and sir asked us to just see that case, and I still remember that we are fighting over a small murmur, and it turned out to be a dextrocardia, which we all missed. So it's incredible clinical skills and absolute living legend, actually. So we are very happy to have him here. I don't want to go back any further. It's a pleasure and honor to be here to listen to Srinivasan, sir. So thank you very much, and thank you very much for being your student, sir. Thank you, sir.
Thank you very much.
Is Dr. Suresh Balan and Dakshani there in this group?
No, sir. They are traveling to IAP-PATS.
Okay, sir.
Janani is there, I think.
Janani ma'am. Janani ma'am.
I saw her name. She was there in the beginning itself. I don't know.
Janani ma'am.
Now I am not able to see her, sir.
Okay, fine.
Yeah. Over to JV sir and Sanjay sir.
Sanjay, are you there?
Yeah, I am there.
Sanjay, I think you can start the presentation.
Yeah, I am there. 1 second.
Right.
Palani Raman is there. You want to hear Palani Raman, sir? I was his examiner in Bangalore for DCH.
Palani. Yeah, Palani.
Very good evening. It's a nice occasion to see my one of my trio who shaped my career in my life, and Professor Amdekar sir, Shivananda, and Dr. Srinivasan, who shaped my career to reach so many heights. But he was my examiner as a DCH student, and even after my finishing my DCH and MRC PCH, but he is continuously striving to perfect my shape in my career, because even now I fear to write a prescription out of unethical issues, because otherwise next day I will get a phone call scolding from him. Such amount of thing and fear, and definitely that is the reason
Sir is muted.
Yeah, you are muted. You are muted, Spiny. You are muted.
Okay, 1 minute.
Yeah, really, he for the past 3 decades, he was one of the pioneers in shaping my career. Even now, but we both travel together plenty of times, and definitely is my really guru par excellence. Thank you, Vanada, for the opportunity. Thank you.
Yeah. Thank you, sir. Thank you, Palani, for coming in between from your practice.
Thank you.
Sir, over to Sanjay, sir.
The President,
Go ahead, sir.
Dr. Yashwant, Secretary, Dr. Vamshi. My pranams to Dr. Srinivasan, sir.
Thank you, sir.
We all revere you, sir. Thank you for giving us an opportunity, sir.
We reciprocate the same feelings, all of you. Yeah.
I really do not know why Yashwant asked me to moderate this session, because honestly, I am not a core teacher actually. I've been for a very short period of time in the teaching side. I am a hardcore clinician and a practitioner, but I have a passion for teaching. So probably Yashwant thought that it's better to call somebody who is passionate on teaching side. So that's why I'm here. We are from that generation, myself and JV. JV also should agree. We used to look in awe to our teachers actually. In fact, I remember very well when Dr. Ajit Kumar sir used to walk in front of me, I used to turn by the side and go off, because we always felt that there was some reverence, humility, and respect for teachers. In fact, I have the same impression on Dr. Srinivasan sir, and my association with Dr. Srinivasan sir is somewhere in the 2012, when Rohit became the president actually. When Rohit became the president and he asked us to do the tips module, and I was very fortunate to interact with Dr. Srinivasan sir. In fact, we had some of the very best teachers in the country. Dr. Piyush was one of those conveners. Dr. Varinder was there. Dr. Bala was there. Dr. Sethi was there. And Dr. Srinivasan sir was there. He has got a sense of childish inquisitiveness in him. We always look at awe with him. Yashwant, can you just enable screen sharing for me? Yashwant, can you enable screen sharing for me?
Yashwant, you got it? Yashwant, did you hear?
I've done it. I've done it for you.
Okay,
Yeah.
that's fine. Are you able to see my screen?
Yes.
Yes,
It started
yes.
already. Presentation started, right?
Yes. So there were only two words with which I can describe Dr. Srinivasan, is that he is extremely affable and he is extremely humble and humane. In fact, I rang him up about 1 week back and then told him, sir. Then he said, please don't call me sir. And then the only way I could stop him from not interjecting, telling sir, was, sir, you are also calling me sir. So that's how affable and humane he is. He has dedicated his life to teaching. He has got 5 decades, more than 5 decades of experience as a teacher. He has more than 150 publications in both national and international journals. He did his medicine from Madras, Chennai now, in 1969. Maybe I was 12 years when sir finished his MBBS. He did his pediatrics diploma in child health from again Chennai in 1970.
Not Chennai, JIPMER, but Madras University. University is
Madras University.
But I studied in JIPMER. Yeah.
So, sir, you have got more than 5 decades of association with JIPMER, sir. So, JIPMER
Right
breeds,
from that time, it was this thing inaugurated 1964. Yeah.
Sir. He did his MD pediatrics from Delhi. I don't know. I'll ask him when he is doing, but why did he go
Maulana Azad. I was 1 year junior to Ashok Datta and 2 years junior to Panna Chaudhary.
Sir. He did his MD pediatrics from Delhi, Maulana Azad, 1976. So that's how I understand how we can integrate North and South together, actually. He did his course in nutrition from the National Institute of Nutrition, Hyderabad. Sir has served if I look at the way it is from 79 to date, sir has served in every capacity as a tutor, as a senior resident, as an assistant professor, as a professor, as the head of the department, as the director of JIPMER from 79. In fact, I was told by Yashwant that sir used to cycle to JIPMER to keep himself fit and fit both in mind and body, sir. Am I right, sir, that you used to cycle?
Yeah, that is how we were going those days from town.
I think there is a
Yeah.
photograph where he was on the cycle and with
in Vespa scooter.
that is another Vespa scooter. Yeah, later, of course. Yeah.
That's how it is actually. Dr. Keshav, I see here.
Yeah, because they come here, we conduct regular courses, 7-day courses in Rajiv Gandhi Hospital.
Sir, I remember at that time, but this appears to be a Honda, sir, not a Vespa.
So no, not Vespa. This is
he has given a lot of orations all over the country. He gave the faculty oration of JIPMER yesterday, today, tomorrow. He gave the Y.R. Reddy endowment oration at Hindupur. In fact, I had gone to that conference there in 1999. I'm sure JV must also have been there.
Yes.
Conference. Remember JV?
Yes.
Dr. Keshav who did that conference.
Yeah, I know.
Dr. Harishchandra Memorial Oration, Dr. Tirumal Rao Oration, Dr. Bopaya Endowment Oration, Mysore, Dr. K. Krishnamurthy Oration at Madurai, Dr. Parvati Endowment Oration in the Institute of Child Health, Egmore, Chennai. I am sure, sir, there must be a big list and you have tailored it to
a few more were left out,
Yeah, sir. He has got an extreme amount of research experience. He has dedicated his whole life to teaching and research. We are honored, sir. We had a lot of people. We had 13 speakers, but they were a mix of both teaching and practice. I'm sure we rarely see people like mentors like Dr. Srinivasan who have dedicated their life to teaching. There were greater avenues to go, but still he has chosen and dedicated his life to teaching. I'm sure he's very satisfied to see most of his students doing brilliantly in different parts of the country and abroad, sir. He has guided a lot of postgraduates in research works. He has done a survey on rheumatic heart disease. He has done a survey on enteric fever, polio, pyogenic meningitis, tuberculosis meningitis, viral encephalitis, pneumonias, and some of them we are not even seeing nowadays, sir. Like polio, we are not seeing, sir. Measles, we are not seeing so much.
Actually, myself, we went for the cluster survey of polio immunization, oral polio. Actually, the cluster fell on Vellore, but Vellore was giving IPV. So then the nearest village was taken, where OP, IVP was not given, OP was given. So myself and Parsare were together for 7 days, and Hanmantaya, this thing, P&S, some professor came with his students from Hyderabad to this thing, conduct the survey. We were the people, Yeah.
He has more than 110 publications in index journals, Indian journals, and 30 international journals. I was wondering, sir has sent some photographs. I was wondering why this photograph was here. So today morning I rang him up and asked him. Then he told me one reason. I could not see Mahatma Gandhi, but I wanted to see Abdul Kalam. And I went there because security was not so, security could be bypassed because sir was a faculty of JIPMER and Madam Srinivasan was also there. So look at his passion and childlike mentality, just to see Abdul Kalam and to get some inspiration, sir was there. So I didn't understand what this photograph was. I asked sir, what is it? And Dr. Srinivasan, please convey our regards to Madam also, sir. Madam is also a very respectable teacher and she is an ophthalmologist. She is still pursuing her teaching career in Pondicherry. Sir's areas of interest are on breastfeeding. He's passionate and he's one of the founder members of the Breastfeeding Promotion Network of India. it's very appropriate that Dr. Keshavlu, good evening, Keshavlu sir, has joined
Sir,
at
good
the
evening,
right
sir.
time when I'm talking about BPNI. Whenever I see Dr. Keshavlu, the only thing which comes to my heart is look at this man who has dedicated his life to BPNI, and look at Srinivasan sir, who founded a BPNI, Breastfeeding Promotion Network of India. It's nice to have you, Dr.
Keshavlu
Keshavlu.
will tell how he was brought in, sir. Keshavlu, why don't you tell?
Yeah,
Yeah.
Dr. Keshavlu.
Sir, actually, uh, I was very much interested to join in as a senior resident in pediatrics at JIPMER Pondicherry. So when R.K. Puri, hello,
Yes, sir. We are able to
am I
hear you.
audible? Am I
Yeah,
audible?
you are audible.
Yes, yes, you are audible.
Yeah.
But from somewhere there is a background noise coming up.
Yeah, it's gone now, JV.
Yeah.
Hello.
Please
Dr.
carry
Keshavlu.
on.
Actually, when I tried to join as a senior resident in JIPMER Pondicherry, somehow there was some resistance from the then HOD, Dr. R.K. Puri. So at that time, Sir was associate professor. So I went to Professor Srinivasan sir, and then he took me to R.K. Puri chamber. So they had some hard discussion, and then he came out, casually, you leave the place, you go and work wherever you are. Then, as usual, Srinivasan sir was very popular. I'm telling about the late 80s, 84, 85. Then I was attending conferences. In one of the conferences at Chennai, when Dr. Shankar Narayan, pediatric gastroenterologist from ICH Chennai, was organizing a conference at Hotel Ambassador. That time, John Rode, country chief of UNICEF, and Professor Jayam were the guests. And then that time, Professor Jayam has introduced. By that time, I was the father of twin children and exclusive breastfeeding. They crossed 6 months. The madam was introducing to John Rode. See, this Keshavlu is very fond in breastfeeding, and he is a father of twin children, and his wife is exclusive breastfeeding. And he has given me a lot of applause to me. Dr. John Rode, I remember that is in early 90s. Then
Come to how you came
Srinivasan,
in. Yeah.
Srinivasan sir, Keshavlu, you just joined in BPNI. So the BPNI is formed in 91. I joined in 92 through the hands of BPNI. That's how I brought up. I myself claim as Akalava Shishya of Professor Srinivasan sir, because though I was not a direct student, so we were together for almost 3 decades. So we have conducted innumerable IOSCF counseling courses all over the country. So in the near future, in the March, we are having one course in Nilofar Hospital, and then one at MS Medical College, and many others are going. I am very proud to share that Professor Srinivasan sir is like my guru, Dronacharya in Mahabharata. So thank you, Srinivasan sir.
Thank you. Thank you.
Thank you, Sanjay Srirampur sir.
Sir, thank you so much, sir. You are Ekalavya, but you are Arjuna for BPNI in Telangana and Andhra Pradesh, sir.
Yes, yes.
Sir,
So I'm very
sir,
happy to share the Banswada MCS Center today got accredited as a breastfeeding friendly hospital initiative, the first public sector MCS center in both the Telugu states, Karnataka, Tamil Nadu, Kerala. So it's a great achievement.
We went for the training to the public
Yeah,
health.
yeah, we were
department.
together, did TOT and BFHI at Institute of Health and Family Welfare, Hyderabad, from November 31st to December 4th, sir. This is also one of the things which I want to share.
thank you, sir. Sir has got varied interests. He is interested in pediatric cardiology. We'll try to ask him as we go forwards. He's interested in he was interested in most of the things which were very common community health problems in the country at that particular point of time. Now, I was trying to decipher what this photograph is. It's pleasure to see Dr. Murli Mohan, sir. Dr. Murli Mohan was then the Director of Medical and Health. Dr. Gopalakrishna, sir. Sir had come for the 15th National Conference of JV was the treasurer at that time. I was the online secretary. And I see Ajay with all black hair. So I was trying to interpret. Is it Ajay JV?
Ajay. Yes, you are correct.
Sir, it's a pleasure to have you, sir. Why is this not going? So it's my pleasure to introduce Dr. I'll stop sharing, sir. Yeah. It's my pleasure to have Dr. Srinivasan sir on board, and we'll try to find out how he keeps abreast. Sir, when you joined medicine, sir, at that particular point of time, way back in 60s and 70s, when people used to join medicine, there are only 3 reasons, sir. One was to go with the wave. Everybody was taking medicine, we will take medicine. Or otherwise, your parents used to force you that, look, my son is a doctor, my son is an engineer.
No, sir.
Or
Actually,
thirdly
what
was a
happened is,
compassion, sir. Why did you take medicine, sir?
yeah. Actually, this medical college was started by French people, 1955 itself, 45. And subsequently, of course, we used to go to beach, to play cricket. And then the medical college was near the beach, First Time Beach, near the Lieutenant Governor's area. And the medical college administrative office was just behind the lighthouse. And there was a small ground where basketball and will be played. So we used to watch, the medical students then. 3 years senior to me, they are, such wonderful basketball players will be watching. And I used to think, I must also study in this college. And then, that is how, no parental pressure. So, of course, there was no doctor in my family at that time. But this is the main thing, because we used to watch them playing, and they used to play, and then they'll sometimes invite us also to throw the ball into the basket and tell how it has to be done and all. And then probably that initiated the interest in me. And there was only a medical college, no engineering college was there. And basically I was interested. I myself had a thigh abscess, and I went to General Hospital for drainage abscess. At that time, I didn't like the medicine smell in the hospital. But anyhow, in spite of it, I chose to become a doctor. I never regretted, and I enjoyed my whole this thing. And those days, of course, it was based on the marks of matriculation. And there was 25 seats for 20 seats earmarked for Pondicherry citizens, and rest of them is open general. And those days, Kerala, many of them used to come. Most of them out of the remaining seats, Kerala, the marking system is very liberal. So many of my students, they came, and most of them, of course, they left to USA. But I decided to stay there. That, of course, if you give me time, I can tell how I decided to stay.
That is what we wanted to know from you.
Yeah.
Those are the days when people were leaving to greener pastures.
Yeah.
And you stayed back and continued your career in this country. And
so what happened is, during our immediately we have to do senior house agency. Then only we can apply for DCH. Directly we cannot go for MD, unlike medicine and surgery. So you have to do DCH, Diploma Child Health. Then again you have to go for MD. So at what time, that you have to do 6 months in that particular subject. Pediatrics, if you have to do 6 months senior house agency in that subject, and remaining 6 months at the mercy of the clerk who is deciding about the posting related subjects. But what happened is, so many of them had gone to Sri Lanka, my batchmates, and had written and passed the exam, and they were about to leave in between. But they were in the hostel. I was a day scholar, and they were very close to this clerk who decides about that. And they all wanted to do pediatrics, because I used to tell pediatrics is a subject where you have to examine only a small surface area, unlike adults. And children will not keep the abdomen tight and all, so we can easily find out, liver and spleen, we will not miss. I used to tell the advantages of pediatrics, and it's a special subject. Once you do medicine, you have to do something further. But whereas when you take up pediatrics, it's immediately you are a specialist. So that's what I was going on telling these people. Finally, they all got 6 months in pediatrics. I got 6 months in medicine. Every time I used to go and meet the director and tell, sir, I want to do pediatrics here, and they are not posting me. And he said, you come next month before they post. But finally, I got 6 months in medicine, 2 months in skin and dermatology, and the remaining 3 months in pediatrics. And of course, Department of Tuberculosis and Chest Disease also was there. So that is another 1 month I had. So that is how, immediately I could apply to other places in other states. So I had to apply only for DCH in JIPMER and got in JIPMER. And of course, we had to be posted in, one unit was there because JIPMER was far away from the town and the transport system was not good. So there was an attached unit in Pondicherry and 2 people will be posted there as senior house surgeons. And we used to manage after 2 o'clock because the specialists from JIPMER, GH, they will work only till 2 o'clock from 8 to 2. After that, everything has to be managed by us. And that is how we got the confidence, because those days diarrheal cases will come and the casualty medical officer will not take risk. He will admit all the patients. And then, nurses only helped us how to develop, introduce. Those days we have to break the needle and then put the polythene wire, and then with the artery forceps, we have to find out and shave the head to get, those days diarrheal cases and dysentery cases are so common, they'll come in late stage. So that gave us a lot of confidence, and of course, we learned. And then when professor had come from a senior specialist from All India Institute, Kanpur. He later went to Lady Hardinge, and he was the head of the department there. He was a very strict man. So he used to take rounds very meticulously, and he will ask us, and he will want us to remember, and we had tetanus cases also. So we will want us to remember all the details of all the urea, electrolytes, creatinine, etc. And we have to do bedside the lab tests. So that is how, and he asked me to do a peritoneal dialysis. I said, I am there. Similarly, first exchange transfusion GH was done because of Kanpur's insistence that we should do it. Why should we refer the case? So he is very strict, and that is how I developed certain important ethical principles that we must not delay anything. So each and every investigation will be, and when my friend is admitted, he sees Gopal Srinivasan from Salem, only son, and he had written ECMG in Sri Lanka, and he was posted in pediatrics. I was day scholar, and because he was all alone doing duty in this thing, I used to go and help him in the evening till night, 9 o'clock, 9:30, I'll be there. And I used to go with him to the maternity hospital for delivery. So when he went there, he saw a child and he said, Srinivasan, do you know what it is? He had only done 15 days house surgery in pediatrics as compulsory house surgeon, and he had just joined pediatrics as a senior house surgeon. And he went and told me, can you identify? I said, I don't know. He said, this child is having scaphoid abdomen and child is having breathing difficulty. This is diaphragmatic hernia. So 2 things he told. If the child is keeping the mouth open and then is finding difficulty, he said it will be choanal atresia bilateral. And if the child is having scaphoid abdomen, see, this is the first lesson I learned in pediatrics. So such a brilliant man, and he went to Cook County Hospital and stayed there, and he came along with Janaki-Raman, late Janaki-Raman, for Pulse course. He was one of the pioneers in the Pulse course. Yeah, this is how my journey began. And of course, I never regretted, and I then, of course, got my MD in Maulana Azad. I had written later ECFMG because marks were liberally given, and they made it a 3-year course. Directly, they can have entry into after, without senior house surgery. So the subsequent batches where examinations were held in JIPMER, so the liberal marks were given. So naturally, there was no chance for me to get, and the 3 girls joined, and 2 of them left to USA, leaving the seats vacant. It was not filled up, such a waste of seats, precious seats. But anyhow, I never regretted. I went to Maulana Azad, and I had excellent relationship with all the people, and I had Panna Chaudhary as senior, and Datta said, when I am there, you need not worry, because I didn't know Hindi. So they were all so helpful in making me settle very easily. And I really enjoyed my stay, and I learned so much from them. Thank you so much.
Sir, one little corollary to this question, sir. You had the opportunity to go to US, and you had the wherewithal also, sir. You were a good student. Yeah. And you have spent a career span of 50 years in India.
Yeah.
Do you regret that, sir? Or you are comfortable, or you feel that there is something which you could have done better, or you are well placed here? What is your take, sir?
No. Actually, when I went this thing, because 1 year I spent after DCH as registrar in the Department of Pediatrics, and then because it was, though I was selected for this thing in the interview, because there was a long strike when the residency scheme came, and then directors, diploma pass candidates are not allowed to get into further specialization. And he made it. It was we never asked for proof, etc. I didn't go to court at all. Nowadays, people will go to court. Finally, of course, it was given to somebody. But this one made me think of going and writing ESOMJ. These things happen in India, so I thought, why not write? I went that time, even Sri Lanka, my father couldn't afford to send me, and I never also wanted to ask him. Then subsequently, I went to Sri Lanka and wrote, Singapore, and then Malaysia, Kuala Lumpur, and then wrote the exam and passed. And I was about to go, but then I wrote this, the entrance exam was held in Delhi University for the first time for outsiders. And then I had written and I got a seat, so I didn't want to leave it, that opportunity, and I never regret it. Initial 3 months, of course, I didn't have knowledge in Hindi, so I have to manage myself all over. But of course, Dr. Datta and Panna Chaudhary were very helpful in making me settle very easily, and there was no going back, and I enjoyed it. And then I decided to stay only in India. I never regretted that I didn't go to USC at all. I had a wonderful time, and I always enjoyed my work and thoroughly enjoyed. And I had such wonderful time coming as examiners and meeting all of you, and had excellent, of course, just now I saw Indrasekhar Rao, he knows me.
Yes, sir. Yes,
okay. Sir. And Murali Mohan Rao, all these people, they know me. So I never regretted, sir. I enjoyed my whole career, and no regrets at all.
Indrasekhar, sir.
There is one important take home, sir. Nowadays, JV, you agree with me that everybody is talking of burnout. Yeah. Everybody is talking of
yes.
age-related burnout.
Sanjay, I just wanted to ask, sir.
Yeah, please.
Almost half a decade in pediatrics.
Yeah.
And sir, what are your exact feelings about the subject as a whole? And do you think pediatricians have a bit more satisfied and more rewarding experience than other practitioners?
Yeah.
Medicine, that's what I always say.
Yeah. Pediatrics is a subject
take
which
pride
is
that I am a pediatrician.
Yeah.
And our professional experience is much more rewarding and satisfying than others. I really don't know.
Absolutely, sir. You, sir. I always have a feeling that when compared to other friends in other subjects, okay, so they have felt that pediatricians, they are much better off in way of this thing, handling children as well as in talking to parents, etc. And definitely, most of the pediatricians whom I have trained, also who have been with me, they are totally satisfied. They have taken up pediatrics and they never had any regrets. And Dr. I.C. Verma, he came here for 3 years for an Andaman project. They said the project is dedicated to JIPMER, so you have to go there. So he came from All India Institute and he was there when I joined back 2 years. Dr. Khanna was there, K.K. Khanna, who is in Ghaziabad now, and Dr. I.C. Verma joined. And I.C. Verma asked, Srinivasan, why don't you do specialization? Sir, I like the cardiovascular system, I like respiratory system, CNS and developmental pediatrics, okay, and nutrition. Okay, so I don't want to see the child as a separate part. So I want to see the child as a whole. Okay, that is what I told.
That was the reason. That was the reason.
No, that is one reason. The other reason is there was no specially pediatrics special DM. So you have to treat adults also. I never wanted to touch adult again after handling children. So that is another reason. If it was only children, probably I might have taken up. But any specialty, if you have to take, you have to go to adults also, examine them, etc., and may miss something. So it and moreover, I really liked so many special. I was interested in nutrition. I was interested in neurology. I was running the cardiac clinic with. So I really wanted to see the child as a whole, not as a part, as a system, because once you become this thing, then you sometimes miss the other thing which is there in the other body. Yeah.
We welcome Dr. Indrasekhar Rao, sir. It is nice to see you, sir. 2 words on Dr. Srinivasan, sir. You have a very long experience and association with Srinivasan. We are honored to have you here, sir. Dr. Indrasekhar Rao. Dr. Yashwant, if you can unmute Dr. Indrasekhar Rao.
Dr. Indrasekhar Rao I'm blessed by your presence.
Thank you, sir. Good evening, Sanjay and everybody. Thanks for giving me the opportunity. Talking about Srinivasan sir is talking about moon in pediatrics, not a sun. He's a moon. He's a cool person. He is pan-Indian by training, and by virtue of his knowledge, he is great. That's why I call him moon of pediatrics. I have
Thank you,
seen him
sir.
last 30 years. He is Srinivasan. Really, the abilities he is bestowed with are silent, sober, stable, gentle, well-balanced, and all the abilities of a great teacher. He is untiring academician. I don't call him warrior, but the untiring academician. Still, he talks to us with the latest things in pediatrics. I had participated in last year NeoCon with him and all other. Recently in IDCon, we were together, and recently in his young child feeding practice and breastfeeding along with Keshavlu. He's so tuned. He has a tremendous energy to teach what we have to learn. We have learned. He wanted to give back to children. That is why I call him. He's professor for many professors of today, and he's a real mentor for all. We call ourselves as mentors, but he's a real mentor from whom we learn. God give him a lot of energy further to perpetuate his knowledge. In these days, when we are finding young postgraduates holding a cell phone and downloading clinical findings and telling us in a bedside teaching, my heart aches and my eyes become wet. What is that bedside teaching? Our great teachers, Harichandra, Vaisi Mathur and others have taught us, and now it's gone. Dr. Srinivasan sir, I want to ask you a very soft question. What do you think of the clinical teaching and bedside, and what we have to do as a seniors to make them the clinical oriented bedside medicine? Please give us tips, sir.
Thank you, sir. Can I answer, Dr. Sanjay? That it's a very
please go ahead,
important
sir.
thing.
In fact,
Clinical teaching.
one of
That
my
is actually was there in our agenda also.
Yeah, clinical bedside teaching is very important, sir. So I'll tell you with some instances, when I was in Maulana sir as a PG, so the child was having anemia and I felt the pulse. Okay, child was having no hepatosplenomegaly, anemia and pulse. Pulse was usually high volume pulse or collapsing pulse will be there in anemia. This child was a 3-year-old child, but it was a slow, tardy pulse. So I found this is not at all acceptable. Then that auscultated, there was a murmur. Of course, people will think it's a hemic murmur because of this thing, but correlating the ejection murmur in the aortic area with the slow volume pulse. In the busy OPD, in each bed, there will be 3 or 4 children at the same time because it's a municipality hospital, Maulana Azad Irwin Hospital, so overflowing of patients will be there. But that struck me, and then immediately I felt the this thing, lower limb pulse, all were this thing, low volume, and immediately, of course, GB Pant Hospital is the next hospital attached to Maulana Azad. And then we referred, and the child had critical aortic stenosis, and the child was operated, and the child was saved. So this is one instance. And another instance, orphanage child had come, girl from orphanage Delhi and malnourished, and she was all the time hungry because she was so impoverished and nobody asked history of course, she was lying in the veranda, not inside the ward, outside the veranda and the charpai. And that is how the Ward 16, Dr. Satyagupta's unit, professor. And then people who was looking after that particular girl, they had not asked for this thing, and they didn't do the urine examination, but the child was later shifted inside. Once the bed was available, child was, then I took the history. There was history of this thing, and child was having thirst and also polyuria in spite of dehydration. Then immediately urine was not examined. Bedside, we used to do bedside test, gram stain, etc. for CSF, etc. And then urine examination was done. She is a case of diabetes mellitus.
Type 1 diabetes.
Okay. And then another case was there, on kwashiorkor case with blonde hair, and child was having the regression of milestones because of kwashiorkor. We thought it's kwashiorkor, and then we started giving diet and the child was improving. But the child was not improving. Usually kwashiorkor edema should subside within 7 days, and then no child should become cheerful within a particular period. Then after the child was introduced protein diet, then we knew it is something else. And the ferrichloride test was done, it was a phenylketonuria. So these are some of the instances. And of course, Dr. Tirumurugan was mentioning, so we had seen, just now he was mentioning that they were similarly bicuspid aortic valve. So child had bacterial cottage. Child was having fever. They were thinking of ventric fever. Then I said, see, auscultate, there is a click. And it's then it was a bicuspid aortic valve when we did the echo, and then child was having bacterial endocarditis. So clinical bedside teaching is very important, and time should be spent in taking history. For example, this diabetes mellitus, and also lipoid pneumonia. I was mentioning Dr. Sanjay. Our professor of pediatrics, Dr. Balakrishnan, is none other than the brother of Dr. Chandrasekhar, Nobel laureate. And she is also cousin, nephew of Sir C.V. Raman, another Nobel laureate, and Dr. Shanta of this thing, Cancer Center. Adair Cancer Center. So he is a very great clinician. He was in Canada, AB, and then he came to Delhi and he was looking after Safdarjung Hospital. Then he was transferred to JIPMER. He came and he will take rounds, and then he'll go beyond lunch hour, and then he will ask very detailed history of child rearing practices. Then he found that in Delhi, there is so much of cold weather, but so much of respiratory infections were not there. Why in this particular place, children are coming repeatedly with pneumonia? So he went on asking, and then they found that there is a habit of calling some lady who is delivering the children in the villages, and they put oil. Whenever the child is having snuffy, snuffles in the nose and also mild running nose, they put oil saying that they are taking, and then blow through the nose. And he made us do, I did biopsy, lung biopsy. Those days, of course, ethical clearance was not necessary. And none of the children developed complications of pneumothorax, etc. And then pathology showed lipid-laden macrophages. And it was published in British Medical Journal 1972. So that time I had gone back. And similarly, cystic adenoma, of course, many children know obstructive emphysema. We had many cases in JIPMER. He only told, see, you percuss the child, so this child, the air entry is there, but child is still having breath sounds, but it's diminished. And then he told, so look for, and X-ray, he told obstructive emphysema, lobar obstructive emphysema clinically. And after that, we detected so many cases just by percussion. So so many things can be diagnosed on clinical examination, proper clinical examination. So I think bedside teaching should be given importance, but unfortunately, I find nowadays, students, they are not allotted beds in many colleges, and they come only when they have cell phone. When the teacher comes to take the case, then they ring up and they all assemble from canteen or library, wherever they are, and then they come. So I think really, as you say, I think we must try to bring back of course, investigations are important, but investigations are also, it will take time. In a government hospital, every case cannot be immediately given dates and all. We'll miss important things. So many cases of methemoglobinemia were found only on clinical examination. And history of taking, that xylocaine was given. Similarly, well water was taken, and the child had cyanosis because of methemoglobinemia due to well water. So history taking is very important. Clinical examination is very important. Otherwise, you would
Thank you very much, sir. You have given very good inputs.
Yeah.
Actually, all these narration anecdotes, if you find time, make into a book, sir. Please make it a tip, sir. It will be useful. We, the present day professors who are there, should learn lessons from you, sir. As you rightly told, the postgraduates have experience of my postgraduates in the hospital where I am. They will not check the blood pressure, nor leave alone the pulse. They will look at the monitor. It's very difficult to put them onto this. So it's our duty to perpetuate what we have learned from professors to the present day students is the importance of clinical learning and bedside.
Yeah, even dextrocardia, they have missed, sir. This thing, I asked them to.
Sir, nobody is recording. If I ask during the rounds, a pulse rate, no, sir, sister has seen. BP, they look at the monitor. Abdomen, get the ultrasound. X-ray percussion,
Yeah.
get an X-ray. Then what is
Yeah.
that your clinical
Yeah.
medicine learning? It is dying. Clinical pediatrics is dying, sir. We have to revive it and
Yeah,
save
Dr.
all of us.
Sanjay knows,
Thank you.
sir, that we were together in the TIPS program with this thing, So that time I will always say, just like touching the elderly people, the legs, touch the dorsalis pedis. So touch both dorsalis pedis. Similarly, immediately see touch the chest on both hands, you keep over the chest. So dextrocardia will not be missed. Similarly, if the child is having bounding pulse with minimal cyanosis, we have to think of truncus arteriosus, and it has happened in Trivandrum in one of the PG training program. Dr. Elizabeth had invited. As I was entering, this case was being discussed. Then is truncus arteriosus, I told, because it's all very important that we must try to encourage them to examine the child, and we must monitor them. Thank you.
Thank you very much for the
Sir.
great tips, sir. Thank you,
Yeah.
Sanjay, for giving me an opportunity. Dr. J.V. Rao and Yashwant.
I
It's
am
a
blessed,
great
sir,
time
that
for
you have
me.
come in.
It's a great
Thank you,
time
sir.
for me to see Srinivasan, sir, and know few more things. Sir, my sincere request you to jot down when your memory is very good and put them in that for the future generations. Thank you.
Sir,
Namaskar. Vanakkam,
Thank
sir.
you.
Yeah.
Yeah.
Vanakkam. Please go ahead, sir. I have commitment.
Yeah.
Thank you,
Srinivasan,
Sanjay.
Thank
sir.
you very much, sir, for coming in.
Thank you,
Sir.
Dr. Indrasekhar Rao, sir. It's pleasure having you here, sir.
Sir, Sanjay, I just wanted to ask, sir, nowadays these are the days of specialization and subspecialization.
Yeah.
Every person who finishes his MD, PG
Yeah.
would always think of neonatal fellowship, intensive care fellowship,
Yeah.
nephrology, urology, and all that. Do you think, sir, that with this kind of trend, the role of a general pediatrician,
Yeah.
general
Yeah.
MD will go down?
Actually,
in the coming
these
years?
days, I
Is it
always
good
used to.
or
Yeah.
what is the impact?
Yeah,
What
I
is-
always used to advise them, sir, at least you must work for 1 year or 2 years after the MD and know what is a child in toto. Before you take specialization, you will also understand really where you are interested. Because sometimes, you get forced by somebody else and then this thing. But if you work 1 year after or 2 years in a particular, then you will really know where you want to specialize in. And that also gives a important basis on basic pediatrics, all the systems will be known and they will not miss something in the other system. So, but then of course, now that they all want to get settled early and get to, promotional posts. So they want to take up, so we cannot stand in their way. Of course, nowadays, during my time, of course, you have to examine adults also. Now specialization is entirely pediatrics, so they want to immediately jump in because, as such, our medicine is a long career. So they want to settle early in life. Yeah, that is the reason, but we cannot say, kindly wait for 2 more years and get to know more about general pediatrics before you specialize. But I don't think it is ethical for us to tell them and force them to.
that's
But
not
that is the
possible,
correct.
sir.
But I would, if I have a child, I will tell, okay, you please. Of course, she is a cardiologist now, but she did immunology 5 years, PhD. But she was no that way basic sciences. She was thorough, and then she took up cardiology, and she is advanced cardiac imaging. She is doing in USA. So it's very important that at least 1 or 2 years after the MD to know about the child in general is very important from my point of view, but I may be wrong.
Sir, do you agree that because whenever I see my students, I ask the MBBS students, what do you want to do? They say that they want to do post-graduation. Whenever
Yeah.
because I teach students in a corporate hospital now, I
Yeah.
ask my students, what do you want to do? The student says, I want to do hematolo-oncology. Do you think that this wave and craze of super specialization will just be like the general physician's wave, sir?
Yeah.
We have many bad cardiologists, but we don't have a good physician who can integrate an individual as an individual rather than systems, sir. What is your take on that, sir?
Yeah, actually, basic pediatrics is very important, and then they should understand that at least 1 year after, to know exactly which system they are really interested in. They should not go by, of course, there may be some role models in cardiology. Okay, for example, my daughter, she was, she was asked to come for 15 days, 1 month posting in cardiology. There is a special posting in house urgency. And that time, B.R.J. Kannan, who is in Vadamalayan Hospital, trained in Chitra and also Dr. Balachandar, my own brother's classmate. So they are an excellent cardiologist. So they motivated her. That's how she later, after a PhD in immunology, she wanted to come back and did cardiology. So there are role models, and naturally they give their this thing, inputs, and then they want to take up that subject. That is different. But of course, some people they just jump in without knowing what they want to do. Yeah, we have to properly guide them. That counseling is very important. I have written a chapter in Dr. Tangavelu's book and Scott's book, counseling of people to take up post graduation. Yeah, I can send you that chapter, sir. That particular
Please, sir.
chapter. Yeah.
Because there are plenty of teachers here who can motivate students. There are plenty of role models in today's audience, sir. If you can send us the Pediatric Academy of Telangana, we'll see to it that it is distributed to all.
Yeah, sure. I'll send that particular.
Sir, Srinivasan,
There's
sir.
one personal question which I am quite inquisitive to find out, sir. Because I also joined like you in the teaching profession.
Yeah.
But way through, I left it because otherwise looked very lucrative for me. I jumped the wagon from teaching to practice, sir. But what made you continue in that, sir?
No. Nowadays, of course, it doesn't matter because, there are excellent teaching institutions like KKCTH, and also, I have come to teach in Rainbow Hospitals in this thing, that 3 days PG exam going students they were conducting. So there are excellent avenues in private hospital also, and there is more teaching than some of the other hospitals. Nowadays, some of the government hospitals, they don't have that this thing or intense teaching, but there are better teaching in some of these private hospitals. So we cannot generalize, but that is very important because KKCTH have seen PGs how they are being trained. And similarly, in Mehta Hospital right now, I am emeritus professor there. I go there with Dr. Tangavelu. The amount of knowledge and commitment and involvement is more in these causes because they are answerable. Whereas in government hospitals, so if somebody is not there and another person is the senior surgeon or senior resident, second year resident, that is how they try to point out their finger. So I think nowadays after DNB has come, I think private institutions are giving much more importance. Yeah. They are doing such a good work in some of the hospitals are doing excellent work in private hospitals than in some of the general hospitals where they have this thing. So of course it is up to the teacher and this thing student. We have to motivate them right from the beginning, and of course they have to show the path how to get interested in that particular subject or whatever it is.
JV, you wanted to ask, sir.
Yeah, Sanjay.
Yeah, please go ahead.
Sir, I just wanted to ask you, coming back to continuing the discussion, sir. We see a lot of changes coming up in medical education now. Now the NMC is based on more about
some crosstalk is going on.
Some background.
Please tell
me. From 2019 onwards, the batch we joined in 2019. The students are supposed to be taught based on competency-based medical education. Something like really you need to have a small
I myself for this thing, Bangalore, this thing, Rajiv Gandhi,
and
this thing,
more skill-based training than a theoretical kind of thing, with more emphasis on learning skills.
Absolutely, competency-based. So
what is your views on this system, change in the system? And I'm really looking at the way examination system is going. The MD examination is still continuing. In 86, I appeared for my MD examination. Today, 2023, still the examination pattern is same. One long case, one short case, as if that's all about pediatrics. And that's the cases which are
I think competency-based examination with ASCII is very important, sir, because it covers so many areas of this thing. And short case, long case, it depends upon the cooperation of the child. If the child is not cooperative and if he misses some findings, then of course he loses 1 year or 6 months. I think
entire knowledge is tested on 1 or 2 cases. And
exactly.
Your practical exam is
and
over.
We don't know. They must be really a wonderful student. But on that particular day, because of non-cooperation, etc., it may happen. That
best way of being a postgraduate student?
Postgraduate, I think, I'll tell you, I have gone as examiner with Dr. Ashok Datta from Delhi to Chandigarh when Anil Narang was the head of the department, and we had gone 5 times. They continuously they will call. So we have gone, but they have some internal assessment system. So they also had OSCE. For MD, they had OSCE, and I had myself kept this thing, ball wall thrombus picture, echo picture. And this thing, similarly, I had given 5 and others give. So some 20 stations were there, that marks were taken. And also finally, they also add up the marks internal assessment, which have been periodically conducted. I think it's very important to see overall performance throughout the 3-year period. And then some weightage is also given to the thesis. Some questions will be asked in thesis. And also one case will be given for emergency.
Yes,
And
yes,
how he
emergency, yes.
discusses that. And also one outpatient,
normal routine
whether he
OPD
is
case.
able to. Yeah, OPD case is given, and how he interacts with the patients and talks, and how he counsels, all these things will be taken. Yeah, I think it has to be included.
Yes. Sanjay?
Yeah.
Sir, I'm sure there must be plenty of students in the audience, sir. And you have been an examiner since last 50 years or so, 40 years or so, sir.
Yes, sir.
Can you give them some tips on how to get to exam? I know it is beyond the, we are talking of competency, but there is one milestone everybody has to go over is to pass the examination, sir.
Yeah.
So if you could give some insight into tips to master the examination, sir, for the youngsters who are about to write their examinations, or in the next 1 or 2 years, they will be writing their examinations.
Yeah, for a student who wants to really take up medicine, and then they have to be very sincere in clinical bedside teaching. They should not miss. They can miss theory classes. Okay, because now 150 students, 200 students are taken, and the teacher, the mic system, if it's not working, many of them may not be able to listen, and they'll all be having their cell phones and they'll be watching. So they also think they also everything, all the books downloaded in the mobile phones, in the computer.
They have on their devices.
They think they can read at any time. But we must be very this thing, particular that they attend the rounds, and then allotted beds they work up, and then we must see, and then they have to monitor. We have to monitor their logbooks, whether they are doing a good work and all. So, and of course, one must be there to monitor them. Okay, so some senior postgraduate or somebody should be given the responsibility that they are not coming only at the time of case presentation by the postgraduate. So they should be there, even undergraduate for that matter. So they should be monitored, and then they should be there from previously when we are 8 o'clock till 1 o'clock, we'll be there. Only when there is a postmortem, we have to attend 20 postmortems, then they will say there is a postmortem, please go. Otherwise, we'll be there in the ward. We will not even waste one. Sometimes we go for one cup of tea nearby, but we never wasted our 3 to 4 hours of precious clinical time that we should bring back. But nowadays, I find them, they all have cell phones. They will be somewhere loitering around, and suddenly they ring up, and then they all assemble at the time of
the message.
Yeah.
That's all.
Yeah,
one group message, and they will be there.
Yeah. So it should not be there.
After the lockdown, it is Zoom meetings actually. So whether you attend or not, if your name is there on the screen, then you have attended.
See, of course, this webinar is
somewhere else, and then still you are
this
attending.
COVID has changed the behavior pattern much more. Okay, now they think that everything is available in video form. Yes. All the case discussions are available in the video form. Anytime they can learn from them. So that type of attitude should not be there. Learning from a patient at the bedside, the way they counsel to the mother, how they take the history, all these things are very important. I think it is our duty that this art of eliciting history and examination should not be given backseat. However much the investigations have come. For investigations to focal, we have to have examination. I can tell you recently, one of my own beach walking friends, my undergraduate, schoolmate, he was having cough and he wanted to go to ENT, and that day he happened to be in they have wheel alignment center. I was sitting. Suddenly his breathing difficulty was there, and I asked him he was sitting in the chair. Then I found one shoulder was sagging. That is right side shoulder, and then I found, then I asked him, went to a separate chamber and a percuss. There was a middle lobe collapse, and finally bronchoscopy was done. He was having tuberculosis, and he was treated for tuberculosis. So it's very important that clinical teaching should be given importance, and they should not be given this thing, backseat. Yeah.
You're perfectly right, sir. The way just a simple observation led to such a huge diagnosis. I think that's a learning lesson for most of postgraduates to develop that eye to look, mind to think, sir. Sir, I'm sure Yashwant and Vamshi are looking, staring at me how long this. So
Yashwant, you tell us, Yashwant, another 5 minutes. What is your?
Yeah, you can go ahead. You can go ahead. No issues.
Sir, in this span of such a long career in teaching and clinical practice, sir, with two brilliant daughters and son-in-laws and lovely grandchildren. You told me yesterday your grandchild got 2 gold medals.
Yeah, that is in sports. That is in sports. Now after
That's also
COVID,
important, sir.
no, after COVID, his attention span is a little less, because that this thing, getting adjusted. Everything is webinar class. The other day he was learning Sanskrit in this thing. I was there with him in Madras. The teacher is talking and he was looking somewhere. As I said, you concentrate. So concentration has become a big problem in children because of the COVID. But of course, he is adjusting now. He is becoming back. But yesterday he was proudly showing. And of course, the other grandchildren, they are doing well in USA.
But how could you balance your family and your passionate teaching career, sir?
No, both of them go simultaneously. So, so I enjoy, and still, of course, as Dr. Keshwalu mentioned, we are coming in March. I'm going to Mangalore for 3 days. That 3rd, 2nd to 5th March, they are conducting. They wanted me to be all the 3 days as one of the teachers for all the sessions, irrespective of whether Dr. Subbarao is taking or Dr. Bala is taking. They wanted me to be there. Okay, and then after that we are having in Hyderabad 7-day course in Nulifar Hospital breastfeeding training, and again Bangalore Ramaya Medical College we are having another session. June we are having another session in Pondicherry Rajiv Gandhi Hospital. So still even now today I didn't go to JIPMER. Otherwise I make it a point to go. And indirectly, I give a hint to these people that even at this age, I am going in scooter, and then
you ride a two-wheeler, sir?
Yeah, two-wheeler. I don't drive car. Yeah. So I dashed against the wall of the compound, and then 10,000 I had to spend. My wife said, "You're right, don't go." So I go in scooter because it's easy to go in Pondicherry in scooter, and parking space will be there. Otherwise, And I go there and I go punctually, and then so indirectly I give them, and I attend the rounds till the end of the rounds, and then I come. So of course there is no objection from the faculty, except one particular unit. They don't want me. I don't this thing. But otherwise, whenever I am free on that particular day, I don't miss the opportunity to go and learn from the patients. So many patients are coming of different types from Bangladesh, Calcutta, and Bihar and Orissa, because everything is free. Most of the investigations are free. Some of the costliest drugs are being given. So all types of cases are being worked up very well. So naturally, I'm still learning. So I'll continue to be learning from all of you. Thank you.
Still, you are going to Sikkim, no, sir? You're not missing your family.
No. Family, she is going,
Yeah.
Family is in USA, and this thing, evening when we are there, we talk to them. Yeah. So my wife will be coming at 5:30, but the time I'll be there. But usually, So there is time for everything. So there is, if you know how to manage time and this thing, but this is rich clinical experience which is available, and the people have not barred me from coming. Okay, so they also allow me to, and of course I find in this rounds, so the boys, previously when the rounds is going on, the professor or the reader or whichever this thing lecturer, he will ask each and everyone in the rounds, right from house surgeon to the senior postgraduate, he will ask one question to keep them attentive. But nowadays, these boys are having their cell phone, and the investigations are also in the, brought in the cell phone, like CT scan, MRI scan, etc. And most of them, by the time the boys start presenting the case, as soon as the consultant comes, they are not waiting for the other people also to join the rounds. Just 2 minutes it will take for them to join. And he talks in such a voice that the other people will not hear, but they don't bother about it. Yeah, I tell them, why don't you talk loud so that they also listen to you. I think we have to be very very careful in these people coming and attending and also participating in the discussion. Yeah, and I have told Dr. Sanjay one case I will mention, sir. So that will be the last thing. My professor was taking rounds. We had a case of meningitis admitted. She was an 8-year-old girl, and subsequently child was LP was done, lymphocytes were there, and history was acute. So we thought it's tuberculosis meningitis, but of course those days we do only panties test, and this the sugar was less, and only lymphocytes were there, and there were no leukocytosis. CRP also was not there during that time, and child was put on tuberculosis treatment. But next time, she became all right within 3 days, and after about 1 month, she came back with fever. And that time, everything, LP was done. It was, turbid and was looking like pyogenic meningitis, and leukocytes were there, and treated as pyogenic meningitis. Again, she became all right, went back, and again, after 2 months or something, she came back, and that time LP was done. And we thought probably there may be, they are all taking bath in well water in villages. So it can be acanthamoeba or something, they've said, as soon as microscope, immediately CSF, there was movement of the cells. So then we asked the pathologists, they said, no, disease leukocytes, when you mount it immediately and see, it will have phagocytic movement. So it is not acanthamoeba. And finally, child, then one house surgeon who failed in medicine, but a brilliant fellow, he was preparing for going to ECFMG. He passed, and he was a house surgeon in pediatrics. So his name is Emati. He recently died in Dubai. So that boy is from Kerala, and then he was only house surgeon at that time. And he, in the rounds when this case was coming repeatedly, he politely told Professor, sir, can I tell you something? He said, why not? He's Dr. Balakrishnan, brother of a Nobel laureate. But he was very attentive. What do you want to tell? Sir, I'm reading Harrison to go to write ECFMG. So I read an entity called benign recurrent meningitis. It's called Morar's meningitis. Then he said, why don't you bring the book to this afternoon? And he brought the book, and then he found. Next time when the child was admitted, nothing was given. Only observation, child became all right within 2 days, 3 days, except mild headache and vomiting. And then we referred the case anyhow to rule out other causes of recurrent meningitis to Chennai for various investigations. They also said it's Morar's meningitis. That time we didn't know it was the virus, and virus culture was not there. But later, after, of course, I wrote the paper, but I went to do my MD. I didn't submit it. Those days we had to write in handwriting only, not computer and all. I forgot to give to professor and went away. Then subsequently, after 5 years, Dr. Vishnu Bhatt was my junior, my brother's classmate. And then subsequently, he was doing thesis in pyogenic meningitis, and retrospectively this case was seen. Then he saw the case sheet and then called the child's address was there. She had grown up. And then subsequently, Dr. I.C. Verma was there. It was published in their name in Indian Journal of Pediatrics, Morar's meningitis. Of course, now it's due to a virus. Doctor, of course, Sanjay has read about it. Yeah.
Thank you so much, sir. Because the other day when I was speaking with you and you said Morar's meningitis, I didn't know it was Greek and Latin for me. So like the modern day students, I was speaking with you and Googling and seeing what is Morar's meningitis. Hats off to you, sir. Even from a junior house surgeon, there are learning lessons which we can take, sir. Thank you so much, sir. We have amongst the audience Dr. P. Venkateshwar Rao, Dr. Tilak Chandrapal, Dr. Lakshman Kumar. If there are any questions from the audience.
There is one question, sir. There is one question.
Yeah, please.
1 minute. What is the future for a general pediatrician who is not planning to specialize further? Dr. Sundaresan, I think is your student.
There is always future for everybody. A general pediatrician will always be sought after. So they need not have any worry that this thing. They will not have any regrets also that they haven't done. So specialists will be there, but general pediatrician will be still wanted. So it's not that. Raman is there a standing example. So he is still sought after, and he is now a star in the sky, important star, whole star for IAP. So he is very much wanted. So similarly, Tirumurugan is a neonatologist from UK. So he is also wanted. So there is space for everybody. So I think if general pediatrician looking at the child as a whole and then trying to find out correct diagnosis, correct system, or two systems may be involved in the same child. So it's very important. For example, polycystic kidney, liver also will be involved. So it's very important to find out. So the general pediatrician will not be starving. He will be still wanted. And there is enough space for all the specialists as well as for general pediatrician. And if they want to be general pediatrician, we should encourage them, and such people are essential in the society.
Good evening, sir.
Any more questions?
Good evening, sir. I'm Dr. Tilak. Sir, very nice conversation, sir. As you are entering the medical college, as you are coming out of the medical college, I entered the medical college in '69 when there is no pediatric ward. And pediatrics is a part of medicine with 2-3 questions and 1 or 2 spotters, that's all. But now, medicine, they are writing 6 hours of theory in undergraduation, I mean to say.
Yeah.
And pediatrics, they are writing 2 hours of theory.
Yes.
But
it's
still, the
a
clinical
separate paper.
examination, it is a 1-day complete examination in medicine and pediatrics.
Yeah.
I think some pediatrics, it has to change a little, not like a long case, short cases, and viva. So some change should be there. That's what I think.
Yeah. Actually, in this thing, Kalavariswaran Hospital, they kept this thing, one emergency case, one spotter, like infant tremor syndrome, infantile tremor syndrome, etc. And also counseling station. Even in Mahatma Gandhi Medical College, where I worked, 40 marks are given for counseling that particular child.
Yes.
So all these things are very important.
So that should change all over the India.
Yeah, the examination system should change actually. Yeah. Undergraduate as well as postgraduate.
Yeah. So station, something like a DNB examination, it should be conducted in
ASCII stations where every case scenarios, different aspects of
yes, sir.
management. That's
very nice talking to you, sir.
Thank you, Srinivasan sir. Very nice.
Dr. Tilak sir is also a strong learner, sir.
Thank you, Srinivasan sir.
Thank you very much. Thank you. Really, very kind of you to invite me and give this honor. Yeah, thank you so much.
Yeah, Dr. Nayaz Ahmed is there.
Add some more, sir, but that's okay. Tirumurugan here. Hello.
Yeah, Doctor.
Continue.
Please go ahead.
Continue.
Yes, sir. Sir, actually, there are a lot more qualities about him which he hasn't talked. Maybe some of which I can tell actually, maybe so that students will know how intense he can be. Even when we were postgraduates, I still remember that he will be the first person to read any journal which comes into the library, and the next day you will discuss. Actually, we found it very difficult to catch up with him because the moment the journal comes, by the next day or within the next couple of days, we would have finished reading the journal. None of us as postgraduates will be able to do it. Similarly, you would read any major textbook of pediatrics at least for a couple of hours every day. I mean, we struggle to read for even 1 hour in a month, but he used to, and I'm sure he does it even though these days. And he was very, very affectionate towards children. He would get very annoyed if we mistreat children. Actually, that was something.
Sir, you are muted, sir.
You muted yourself.
Oh, sorry, sir. I didn't realize.
I know.
No, he was somebody
just now only.
Extraordinary, sir. In the sense that he used to read every journal which comes into the library. The JIPMER library was very vast, and he would read every journal. By the time it comes within 1 or 2 days, not only pediatric journals, even medicine journals, and he would read at least 2 hours every day any major textbook of pediatrics. In spite of the fact that he had such a knowledge, I still remember. I mean, he would quote journals from 1900. I just never knew how it was ever possible. I mean, and JIPMER library used to have those dungeons actually pretty much where they had all those world journals and he used to quote all that. And beyond that, he was very affectionate. I mean, see the principles of communication, being nice to patients. These are all things which we learned. I mean, at least I learned when I went to UK, but never in India. But it was something which he used to emphasize how much it is important for all us, even as students. I'm talking 25 years back when we were students. So, I mean, there's so much more to talk about him. I think, see,
Thank you,
you
Dr.
had to
Srinivasan.
Thank you.
you had to do a lot of good things to be a student. That's all I
Yeah,
can say.
thank you. Thank you.
And
Thank you.
I think myself, even Palli Raman as a NPG, and so many of us, we were very, very lucky actually to be his student. Even today, as sir was saying, I am scared of writing a prescription because I always think what will happen if this prescription goes to sir. And that is the kind of ethical attitude he has to instill in all of us. And it's not just me. I can talk about every student.
One of my passion is rational drug therapy. And I used to tell, Nimusalid is somebody wrote in the PG from outside PG. Nice, he wrote. See, we never write this thing, nice. There is no nice about Nimusalid. I am fighting against it because it was banned in all the other countries and they're dumping it in India. Just like, so many useless vaccines are being dumped. Similarly, I was initially against hepatitis B vaccine because it was not containing two idiotopes, which are helpful in the prevention. And there was I read that article and I took a Xerox copy and kept it as this thing. So they were trying to sell it off directly in schools. All schools they were giving concession and freely they were giving hepatitis B vaccine. But didn't contain two important protective antidopes, the idiotopes, which produce antibodies. But all these things were not done unless you read the journal. So they were dumping off all those things, in India. So I told, see, Japanese encephalitis children are dying and vaccine is available in China. Why you can't prevent them? Adults are dying, those who are working in the fields, and there are so many children coming, 40% mortality, and they are all young children who are all having good life, good future, not cardiac disease, congenital heart disease, which are not operable, etc. And they are dying. They are not even taken into the bus to come all the way from villages to JIPMER. But 40% mortality, when there is a vaccine, you are not telling, you are thinking hepatitis B to be prevented to prevent lung cancer, liver cancer later on. That comes later on. But then without if you use sterile needles and also safe sex, hepatitis B can be prevented. And moreover, they are dumping that particular vaccine without telling the truth. Now you know about COVID vaccines. How many COVID vaccines are there? What are this thing? So they thought I am an anti-vaccine man. That's what they were telling. I was not anti-vaccine man because I read about that vaccine and they were dumping it. I was against that. So I was very passionate about. Similarly, another thing is cyproheptidine. For all anorexia children, they were giving Bonisan and cyproheptidine. And cyproheptidine causes insulinopenia. It causes, destruction of pancreatic beta cells. And then I said this must not be used because these children, they feel hungry. And then they eat and they go to sleep also. The BMR also comes down and they put on weight. So this is one of the reasons, I was fighting against these unwanted things and grey water, etc. and powders which can cause allergy. Borax it contains. So recently there was a skin professor who talked from Gujarat. Okay, Palinavan was also there. He told no powder at all for children. Okay, now you know that Johnson powder is causing cancer and they are given billions of dollars as compensation. So these are things which are I was very passionate about. Breastfeeding.
Thank you very much, sir.
Thank you so much.
It's our privilege, sir, to have you.
Thank
it was
you.
a wonderful interaction, sir. We know you were coming to Gandhi as frequently as
You must
examiner.
not thank me. I have to thank you for giving me this opportunity.
Sir was a very strict examiner as far as examination is concerned.
I am not strict.
But liberal at the time of result.
No, I was not
You
strict.
will ask
I was
so many
asking
questions.
only basic questions. Growth and development,
you will ask so many questions.
Yeah.
You will not leave the candidate. But at the end of it, the candidate is happy because, if
they must know about growth and development of the child. When the child doubles the birth
Thank
weight,
you so
triples
much,
the
sir.
birth
Thank
weight,
you.
and
Sanjay?
thank you.
Sanjay.
Let us, I think, conclude.
Dr. Yashwant, over to Dr. Yashwant.
Yeah, sir. Thank you, Dr. Srinivasan sir. Thank you, Saren, Dr. Palani Raman, Dr. Indrashekar Rao sir, all the students of Dr. Srinivasan sir, and today's host, Dr. Sanjay sir and JV Rao sir, for reinitiating the practice pearls from the legends. Thank you so much. Thank you so much. We
Thank you,
thought it
Ashwin,
will
for
be 10,
giving us the opportunity
but we
also.
continued.
The thanks must come from me, not from you people.
No,
Thank you so
sir,
much.
you rightly deserve the
Sir, it is
praise.
your humbleness,
What
sir.
you deserve.